Hi, I'm Helen Osborne. I live in West Yorkshire. I was 11 when I was diagnosed with diabetes, and I'm nearly 64 now. So my life has been completely ruled by diabetes.
When you've got diabetes, or hypertension for that matter as well, we know that the patients are at a much higher risk of developing chronic kidney disease. Chronic kidney disease is a disease that can deteriorate into a really serious condition for them. If we can prevent that from happening by stopping the progression, they might not get severely poorly.
I spend a lot of time having various tests done. Urine tests in particular are something we have to check on a lot.
Of those 44,000 patients who have completed the Minuteful Kidney service, we actually found that on average many of them haven't been completing their ACR test for about 3 to 4 years. And what was so brilliant about working with the local clinicians, I think we actually worked with over 90 practices in the West Yorkshire area, and in Humber the uptake was so rapid we ended up having to extend the service because we had more patients that were coming forward and more practices that were coming forward who wanted to take part.
What we found is, especially during the pandemic, less people wanted to come into GB practice, and so they weren't collecting or returning their urine kits to us. As a result, remote home monitoring of urine tests for chronic kidney disease has proved to be beneficial in that it would increase the uptake.
When I was told that I was going to be doing a kidney test at home, I remember thinking, how do I do that? How does that happen? And then this lovely kit arrived in the post, and I opened it up, and I've got to be honest, the written instructions were really clear.
Our role in this, in terms of health inequalities, was to help look at some of the data initially. So we looked at the National Diabetes Audit to find out where are those patients in our most deprived communities that actually would really benefit from this test.
We know the big challenge on innovation and technology is adoption and spread. We've had 2 peer-reviewed pieces of research here which demonstrate this works. So a programme like this, which can help us identify people at risk, is exactly what we should be doing.
After doing the initial reports to identify those patients who would benefit from this home testing, the impact on our practice was actually very minimal. All that we had to really do was look at and file the increased number of ACR results that came into the practice.
Scalability with innovation is vitally important, and we helped Healthy IO achieve this at scale, and through a couple of methods really. The first approach and the first method is let's get some evaluation, and we had that. We did a small pilot project in 2 practices in the Humber region and in West Yorkshire. That enabled us to have some evidence that this works economically and for the patient's benefit.
Working with the AHSNs is really invaluable, and Yorkshire and Humber have been fantastic partners to us over the years. Not only have they really supported us with things like the evaluation, but they have fantastic expertise both commercially and in innovation and scaling, and they have those local relationships that we just couldn't do it without them.